everyone. I'm Neeti Daftari. Welcome to our third webinar. Today we have three amazing leaders from Bulgaria and Costa Rica who are here with us today to share some strategies as well as challenges of effectively engaging with parents and families of children with cleft within the pandemic context. To make the most of this webinar experience, please put up your full name. That makes it easier for everyone here to interact and respond to each other. If you need to change your display name, just click on the participants button below and you will find the option to rename yourself. If that's difficult for whatever reason, you can just use your chat box to type out your name to let us know who you are and where you're from. Please keep yourself on mute during the panel presentation. Zoom has these reaction buttons that you can use at the bottom of your screen. So feel free to use those buttons as well as the chat feature, as well as the raise hand feature to share what you're thinking or feeling or have questions about at any point during the course of this webinar. Post the panel discussion, we'll invite you to ask questions. You can either type out your name using chat or you can directly ask questions by unmuting yourself. As always, we will begin with a short COCP update, followed by the panel presentation that will last for roughly 25 minutes, which is then followed by questions and discussion for the remaining 25 to 30 minutes. So overall, the webinar will run for an hour. The COCP has three core objectives. Our aim is to facilitate collaboration and networking amongst cleft professionals with an interest in comprehensive cleft care in LMIC context, to communicate impact and learning that's happening within cleft care, and that will in turn support the growth of local teams in implementing comprehensive care. We're constantly growing. We now have over 400 members belonging to 12 plus specialties within cleft care who have joined us from over 60 different countries. We would love to invite more CCC professionals into our community. So if you know someone who might benefit from or would be interested in joining us, please invite them to apply for membership through our website. The COCP represents professionals from across all CCC specialties, including nutritionists, orthodontists, social workers, nurses, and so on. A majority of our members, as you can see here, are surgeons and speech therapists, accounting for over half of the membership. These are the 62 different countries around the world that all of our members come from. The ones in green being the countries that we have the largest membership from. The COCP is made possible thanks to these 10 international charity organizations from around the world who believe in supporting comprehensive cleft care in low and middle-income countries. I now invite you to introduce today's topics and our three panelists.
Fantastic. Thanks, Neeti. And thank you everyone for being here. We're glad you've joined us today, whether it's this morning, this afternoon, or this evening. This is a topic that is really high on our agenda. You know, what do we do amidst all the restrictions of the pandemic that go forward and come back? How do we support parents, especially parents of new cleft children who are missing appointments or having delays or not sure how to access care the way they did before? So we have three teams today, one from Bulgaria, one from Costa Rica, three presenters, two from two different organizations, one from Bulgaria, one from Costa Rica, who've been doing a lot of thinking about how to make parents feel really empowered and involved during this difficult time. And I'm delighted to introduce Ms. Jana Angelova. She's the chairperson of a cleft organization called ALA, which you'll hear more about, and a partner of Smile Training Transforming Faces. And then two leaders from a cleft organization called Association LPH, so Ms. Lisseth and Ms. Carolina Rivera, and they're going to walk through also what they've been doing in their context. So we're delighted to hear from them today. Association LPH is supported by Deutsche Cleft Kinderhilfe and Transforming Faces, where I'm the executive director here in Toronto, and we're really delighted to have them on board. So without further ado, we'll pass it over. I think Jana's going to start us off and tell us a little bit about how have you been engaging parents and what have you seen as the impact? What have you been learning in terms of caring for families during this difficult time?
Okay, I'll start with my presentation. Just have to share my screen. Share, okay, and make it wider.
Success. Well done. That's the first the first challenge of presenting internationally, and you've mastered it. Well done.
Thank you. Hello, everyone. I'm really glad to have this opportunity to present my organization and to share with you how we coped with these difficult times during the pandemic. I will start with some information about my country. This is Bulgaria. It's an Eastern European country from former socialist bloc. I hope you know about this. And another additional information, the population in Bulgaria is just under 7 million. The incidence of facial anomalies is 1 on 700 burns, and in 2019 we have registered 79 newborns with cleft lip and palate. And to share that 99% of them are treated at Plovdiv's University Hospital St. George by the team of Professor Anastasov. It's important to mention here that the national insurance funds in Bulgaria provide only the surgical treatment for the cleft patients. It is important to know. Our association, ALA, was founded in 1997, and since then we are working in symbiosis with the cleft team at St. George Hospital. We can see pictures from the hospital and part of the cleft team. ALA has a really important role in the treatment of the cleft patients in Bulgaria, and because all our efforts are focused on complementing the missing aspects of the treatment and providing comprehensive care for the cleft patients in Bulgaria. We supply what we do. We supply specific surgical consumables and anesthesia care. We provide weekly multidisciplinary clinics, co-funds the speech therapy and the orthodontic treatment. Actually, we partially pay for the speech therapy and the orthodontic treatment. We provide some psychological support. What we do is maintaining the network of cleft specialists across Bulgaria. We have network of speech therapists, orthodontic, and cleft nurse specialists. We try constantly to raise awareness for the society on the cleft condition and for the health care professionals and parents. We do this by organizing trainings for the cleft specialists, and the picture is our last in life meeting with the members of the speech therapist network. What is one of our very important activities is the work we do with the parents. Actually, we have created and support a network of contact parents. These are volunteers that work to promote cleft awareness and to provide psychological support for the new cleft families. Another tool we are using in our constant contact, and which is very important for our parents, is the medical record database we have created and developing since 2013. This is an online platform where profiles of the patients are recorded, and are actually all these profiles are owned by the parents of the children or the representative of the children. They have the right to choose who to allow to access their data, and actually these are the specialists working with their children. At the moment, we have about 1,260 registered patients. And what is very important to say that this very intensive use of the medical record makes the parents feel more empowered and give them the opportunity to take decisions and make them partners in the treatment process of their children. Actually, one of the main goals of the electronic medical record is to coordinate the work of the different specialists working with concrete child, and to optimize the treatment process, to improve the follow-up of the patients, and to reduce the number of the patient dropout. Some screenshot from the medical record, which is now under reconstruction and update. As a parent or association, we have regular events involving our member families. According to our statute, we have to have at least once a year General Assembly. This is one of our biggest events. Families from all over the country gather to hear our reports and to make decisions on the further development of our association and the plans we have. We also try to have regular meetings with our contact parents. These are one of the most appreciated events during the year. We usually invite specialists from the multidisciplinary team, the psychologist, surgeon, orthodontist, and during these events, we're organizing workshops for the parents, and at the same time, children have many kinds of entertainments. In 2020, in January, we managed to have one event in live. You can see these pictures, they are from a chocolate factory. It was a fundraising event, and parents brought their children from many cities in Bulgaria, and they really loved this event. I think the parents, also us as organizer, we enjoyed have this opportunity to visit the chocolate factory. Children did their own chocolate flavor. That's why, and they had it afterwards. But in 2020, as everyone knows, it was a difficult year. Not everything went as usual. We had a lot of challenges coming from the COVID situation. Actually, in Bulgaria, we had two lockdowns. The first one from March to May, and this lockdown actually led to cancellation of the surgery. And as an association, we decided to postpone all planned in-person activities until October, as we believed the crisis will end by fall, but unfortunately it didn't happen. From September, all mass gatherings of people were prohibited, and after all, the situation went even worse. We had a second lockdown from late October to mid-January. We decided and shifted all our activity where possible online. This second lockdown actually led to the increase of the anxiety and a lot of queries from the parents. As in the meantime, we had some educational seminars, and our new parents for the child from 0 to 5 were already very well prepared. They knew that the timely operation is crucial for the good development of their child. So it was not clear until how long the lockdown will last, and the parents organized themselves through Facebook and wrote a letter to the Minister of Health to seek for solution. And happily, we got an answer from the minister, so the surgeries were resumed from 20th January this year, 2021. It was just parental initiative, and it gave a great results. What else we did during the COVID crisis and the lockdowns? We used a lot of online video conferencing platforms, and it's logical. We try to shift all our activities online. We organized 3 different online seminars for different age group, because we understood that different age group needs different advices, different recommendations. So we invited the specialists from our multidisciplinary team to prepare specific presentation for each age group. And we did these free online educational seminars for parents, which of seminars lasted more than 3 hours. And I was a little bit worried, this is too long for them, but actually the feedback was very positive. They said the time was okay. They had a lot of time to ask their questions and to receive the answers from the specialists. They really were glad with that. The seminars were attended by 66 parents from different age groups. And what we did during these seminars, we did records. And now all these records are available on our electronic medical record library and on our YouTube channel. These records are available anytime, and parents who missed the seminars are able now to look and listen the records. We did many other things, of course, but the most important was staying connected with our parents, with our members. We decided to invite our parents to share interesting picture of their children and share some inspiring, motivating story. And here our expectations were exceeded. We had more than 100 pictures from different families, and under any pictures there were positive reactions with comments. We had a very inspiring story. You can see the picture of Dani, the little girl with medals. Her mother shared the story where Dani like very much climbing, and at climbing she attends international competitions. Actually, Dani has a cleft palate, but it's not so important, just to know. And on Facebook, we also asked our psychologists at the time to give some advices to the family, how to cope staying at home and how to communicate with their children, what they can do to help their children staying so long at home without the possibility to go out and meet friends. And I think they were also very useful. We encouraged our health professionals, such as speech therapists and orthodontists, to make online consultations where and when possible. There were cases with the orthodontists and mainly with speech therapists. What we did, we did our annual general assembly online, and it was a little disappointment because we expected more people to attend it, as we thought it will be easier to attend an event online than to travel for 1 or 2 days from distance area of Bulgaria to Plovdiv. But finally, we held it online. Online, we have also Christmas bazaar. We couldn't miss this occasion. So around Christmas, we had the opportunity to attend a live Christmas bazaar in Sofia, the capital of Bulgaria. And many parents went in Sofia to support the family. Many parents made themselves Christmas decoration, different kind of gifts, and gave them to the bazaar to be sold, and all the money went to our account. Many parents also bought these presents, so it was something very interactive and between the parents. It was really great. As a result, what we had as a result after all our efforts, after the seminar, the educational seminar held online, we did a survey among the parents and we got a really positive feedback. all found the information from the specialist very useful, very high qualified, and they enjoyed all the possibility they had to ask specific questions and to get answers for our specialists. I think it was a very successful approach. The other what worked well was our call out to parents to share photographs and stories during the pandemic. So they really loved this. And the most important for the health of the children was the constant and increasing use of the electronic medical record. This allows a very close follow-up of the patients, and it gives the possibility to the specialist to see the children and to give specific advices. What didn't work, I shared that we expected more parents, more family to attend our online events. Probably for some of them, the lack of computer or internet was a reason. But as I shared, we have the records of our seminars. And what can I give as a tip? The first one, stay connected, use social media. Invite, prompt parents to do something they enjoy doing, as the pictures and the story, share pictures and story, and post useful for information for the parents. We support the cleft professionals to work online where possible. Use the online platforms to provide educational seminar, record them and make them available to the parents who couldn't attend. Use social media to organize both online and live events. I can say that these gave results for our work, and I think they were really useful. So thank you, and that was from my side.
Wonderful. Thank you, Jana. And yeah, again, we'll hear from our leaders from Costa Rica, and then we'll circle back. But you've raised some very interesting points, and I'll be interested to hear from the group about how they would apply some of these Bulgaria-specific examples into their own contexts. So thank you. So Carolina, we pass it over to you and Lisseth. And hola Carolina in Argentina also. Carolina Rivera is going to present now.
Hi.
Hola. All right.
Hola.
Let's go over to San Jose.
Yeah. Well, first, thank you on behalf of the association. We are very pleased and glad and honored to be chosen for this webinar. What we're going to be doing today is sharing some of our strategies or tools for engaging parents to support our services. Okay, well, a little review about us. The association was founded 37 years ago, so it's like very kind of old, but we continue doing our work with a lot of heart. Our main focus is working for rehabilitation. So that means that we have our psychosocial service and our speech service. Then we have huge work related to educational campaigns. That means that every year we have 1 week during the year that it's related to all of the cleft process that the kids have. It's like an awareness week for all the schools, kinder schools, high schools. And this year it will be great because we have a like more technological campaign. Normally it's like paper, but since pandemic, the association has this vision of adaptation. So this year it's gonna be a technological campaign. And then during pandemic, we had a very interesting thing because like most of the countries, suddenly in March, they say all the places has to be closed. So we continue working and adapting all the appointments like from being presential to be virtual sessions of both psychosocial and speech. And we have like really a good amount of patients that continue with the process. And it's very interesting also because we have new patients that even though in person we do not meet them, never, because of the parents start talking and making questions about how they work like speech or psychology sessions. I think that from word to word, the parents gave the information and we have new patients right now. Well, I think that it's very important to understand how we do or what techniques we use to engage parents, but understanding what happened before COVID. Before COVID, we started working on databases, so all the information of the patients, phone numbers, like the kind of cleft, surgeries, all of that, we start working online. Then we always, one of the main areas in the association is that we have a great teamwork. And that means that communication is the base of everything. It's like being in a relationship. If you don't have a great relationship, things would not work correctly. So we have constantly, what we had in that moment, constantly and personally communication. And then the trust, all the things that we're doing in the association, they're doing the correct way. Also, we work training, not also training the parents, but we train different speech or different teachers at schools so they can like understand how to work with the kids during classes or how to even like manage bullying situations. And also we have the donation programs that it's more related to ask the parents for help. Like, for example, if a parent worked at a different like medical place or IT place, so they can like make campaigns to help the association. Okay, well, I'm gonna be talking about the work that we have been doing and the tools that work for us. Before COVID, one of the main areas or the most important areas during presential sessions is the empathy. We see the patient beyond the patient. Like we do not see him or her like a number or like a type of cleft. We see it like a tiny person who has a huge environment and how this environment can positive or negative influence the kid. So this had made us, give us the huge opportunity to continue with this process. And it's like more easy to work with the parents that way. Also, we have an active communication. That means that most of speech patients, and I talk because it's my area, they has very great communication with me, but at the same time, they have the same communication with the psychosocial area. So it's a huge team. Like, for example, probably they do not feel comfortable telling me something related to speech or related to experience about how they treated at school, but probably they will tell Liz, who is my partner, and she will be answering the questions after in Spanish. But like we can like make meetings and discuss the situations that can make some, like probably can bother the parents, or even we can have this active communication with teachers or the school, so we can like support and give a better attention to the patients. Bonding with patients generate trust with the parents, and that's very important. For example, if we had new patients, like right now, sometimes I listen to parents at the sessions. Oh no, well, like for example, with a 2-year-old girl, she did not want to pay attention to you. She's not interested. She's not, and I'm like, Mom, I'm working with your daughter, and probably it's not working. It's like only playing. And it's very interesting because one of the most amazing experience during pandemic is that the small children are the most connected to the sessions. They really pay attention. There's like 45 minutes in front of a computer, and they really interact with me. So when the patients are happy, the parents are happy. So it's like we have to lower the level of work, or maybe not the work, but download my speech work and be more like your friend, so I can engage you to the sessions. And then because we're friends and you're asking the parents to, I want to go to the sessions with Carolina or with Liz or with whatever, that makes us happy because we had bonds with the patients and the parents are happy with it. What happened now? Well, as a lot of countries, we have to make this adaptation. So we try to continue our empathy, active communication, and trust with bonding with the parents and the kids, but in a virtual way. And I think it worked the best because we have technology, and technology short the distances, so they feel more, they feel that it's more personally and that we have more time. Before, probably in between sessions, it's like I cannot like give you more time because I have another kid. But now we have this way to open more or expand our time and give more opportunities to they can talk and explain, or even feel comfortable of talking a lot of topics that probably they will not be 100% related to speech, but they can like make difference or influence the way that the kid probably will not progress or even progress positively. Then we have functional options for sessions. That means that we're very flexible with the sessions. Normally we'll be like, okay, your sessions will be that this day or at this time. But now, also with the flexibility, we can like play with times, or even, for example, now that the kids are going to school, they're not going all the kids at the same time. They're going like different groups and hours. So we have our kids, for example, they do not have like presential classes, but suddenly the teacher calls them, oh, you have to be at school. So the parents called us like, oh, my kid cannot receive speech. So we give this flexibility to move the sessions and give the chance to be not like an 101 session, but we can do group sessions. So they really love this part. Like Jana said, interaction with kids, it's very important. So even it's virtually, the kids love them. Well, the huge challenges for us, one of the main one, it's the patient recruitment, because we had a lot of patients in a presential way, but since we had to close so fast, we lost these patients because they thought that we had closed forever. So now we're working on how we can like attract the patients again. And also we have the technological tools for parents. It's very interesting because the kids now, they are born with the technological chip that the parents probably, they do not have it. So it's more easy for the kids like, oh, I know how to use Zoom, and they use the stickers and they use everything. But for the parents, related more to the meetings or options for the sessions, they're like, I don't know how to use them, but I will use the easiest way. Like we use, for example, for the sessions, WhatsApp Web, or we use Zoom, or we use Microsoft Teams. But most of the sessions, the parents, if they do not know how to use technology, they're gonna be like, oh, it's better to use WhatsApp calls and that's it. So we're trying to get them more technological for not also the sessions, like now, because of pandemic, everything it's by technology. So it's a great way to make them engage to the process. Well, our strategies or the keys that function for us successfully is definitely to be flexible and flexible with everything. Communication channels are the basis for us, and that means that my cell phone, even I start working at 7:30 a.m. and I finish at 4 p.m., my cell phone is green light. Like, you can send me messages, the parents, at 6 a.m., 7 p.m., or if there's an emergency, even on weekends. So that kind of flexibility gives, I'm not saying that the parents are calling me every time, but that kind of flexibility gives the parents some peace, internal peace. Because, for example, surgeries start like again at the end of December. So most of the parents had like very delayed surgeries. And I have calls for the parents like, what do I have to give to my kids for food or the care, or if it's bleeding, or if it smells bad because they have the doctor's appointment like 6 months later. So this communication, being more flexible, give their like internal peace, like, oh my God, is this normal, or is this not like what we expected? Also, we have like our workshops with parents and children, and it's very important this, because it's not like we're not working speech. I always tell the parents, we cannot separate speech from all the different areas, because it's a human activity. Like, even though we cannot verbally speak, we can speak with our face. So communication, it's everywhere. So the workshops, sometimes we're not like directly involved in speech, but we're trying to make them like social interaction, follow instructions, different learning abilities that the kids should be having. But because of there's no interaction, personal interaction, we're trying to make these during virtual workshops. The same for the parents. We have different topics, and I always tell my partners, every week we have a special topic that the parents always mention. And like, for example, 2 weeks ago, we had our terrible two. My kid is 2, he's terrible, what can we do? So that kind of topics that the parents present to us, it turns into a workshop for the parents, even if the kid is not 2 years old, but probably he has brothers and sisters that they can use all the information. Also, we have the part of interest and dynamics. The session should be dynamic, and they can be more interesting for the kids. Sometimes the kids, they don't want to work. So I like to play with them. Like Simon Says, or we have to look for the treasures in house. And sometimes it's like, oh my God, what should I be like creating so the kids can engage to the sessions? So even though we have like, you have to go and find your favorite toy, or let's run and see who's the faster, bring in, I don't know, something color red. So we have been working on different areas, not only speech, but also follow instructions, attention. It's like more a global session. And while the technology in the sessions, they really love to be more interactive, using games, using stories. How can we change the way the stories can be told, like changing the characters, or making like, what do you think about it? What can you change? And this is very interesting because we can see different kinds of the way the kids think. Like, for example, the guidance session and the guidance speech, like the kid repeating the things. But when I ask them, like, tell me, what do you think about it? Or what can you change for this? The kid is like, oh, more spontaneously. And then it's like, okay, we can correct this part, but this area, it's really good. So this works very good for the sessions. What worked and what didn't work? Well, definitely what worked was the active communication, and this for the association is our main key. It's the basis of the house. Also, the willing to answer questions even after working hours. For example, yesterday I had a call at 7 a.m. and it was a mother who's telling me like, listen to her, she got the surgery and she's like so excited because she want to work with you. And the kids didn't like, they do not see us like here, like on top. They see us more as a friend. So it's a great way to work with them. And also we have these case discussions that they're like, if Liz and I are working with a patient and the mother, like really, she did not understand what we're saying, probably we have our session with her and try to understand what she thinks about what we're saying and what we want her to understand. What didn't work? It's very complicated because of pandemic. Most of the parents lost their work, or probably the house income is downloaded. So there's a lot of anxiety, or the situation it's more dense in house. So that kind of situation make the parents more sensible related to what we can ask or explain to them. Sometimes we need more engagement during the sessions, and they're like, I'm doing my best, but really we know that they're not doing. But I think that there's like not as, like if you ask, like how many parents do you think they do not engage during sessions? And I will tell you, like with one of my hands, probably 2 parents, because they had responded so positively to the sessions that we like do not have any problem with that. Even though you can like think, and what happened when they're not internet? Well, Liz and I had developed our newest tool that it's call up parents like by phone. Sometimes they do not have internet, so like we call them and they're like, we're gonna be having our sessions by phone, and we're gonna be giving you strategies to work at home, because these sessions or the virtual sessions in generally, it's to provide tools to the parents so they can work at home. We had to change all of our way of thinking to get better results. And like the association, it's very proud because we have a lot of great results with the kids, and the parents, they do not like say, oh, we don't have internet, we cannot work. They always look the chance to have our virtual sessions.
That's great. So I think, Carolina, I know there's been lots of chat and lots of interest in talking about this. So I wonder if you could just summarize these tips really briefly, because I want to make sure the rest of the community gets a chance to ask some questions.
Yeah, I'm gonna be ending with my tips, actually.
Great.
Well, my tips are like our teamwork. We have 1 week session every Friday, so we can discuss what worked with the patients, were not, or if we have like any situation with parents. Also, the stress management at home during sessions. Sometimes we listen to the parents fighting in the back, so we're like trying to get all the kids' attention so it can be more fun and fluidly. And then social media. Now the parents or the kids had all the managements in social media, so it's a great strategy to work with. Also, we cannot have been achieved this work if it's not like the help from Transforming Faces and Deutsche Cleft Kinderhilfe. So we're very thankful about it.
Lovely.
Well,
thank you very much. Well done.
Yeah, thank you.
Great. So we have a few minutes left to discuss. Admittedly, you know, we have two middle-income country contexts, Bulgaria, Costa Rica. So as you've been following along in some of the chat, I mean, let's think about how is this applicable to your own context? What are some of the challenges that are similar? What are some ideas that you have about engaging parents in your own context at this particular moment? Or what questions do you have for either of the teams about some of the things that they tried? So again, feel free to type a comment in the chat session. You can raise your hand or signal that you'd like to ask a question in person, but we'll spend a few minutes just thinking about what this means for each of our contexts as we all face limitations from the pandemic right now. So I'll get us started, I think, as people think through. One of the things that there was noted in the comments by a few people was this idea of having parents together write a letter to advocate for cleft care. You know, in many contexts, cleft care is not seen as an essential service or a life-threatening condition. And yet in this situation in Bulgaria, it was parental pressure that really was able to lead to a change in policy, which allowed parents to get access to surgeries where they were not able to have that. I don't know, Dr. Yuri, do you want to say any more about that that letter and what you responded as, you know, someone on the health side of things?
Yes, just to add that we are trying to educate parents in order to explain them the timings of surgeries. In this period, we had to change and say that timing is important, but it's not so essential and vital. So this was the message that we had to change because people were anxious that they're losing precious months for the surgery. Said yes, but think about the safety, think about that there are intensive care units that are full. So this will be a catastrophic situation if everybody is going to do some surgery that could be postponed for a while.
So you as a surgeon, Dr. Yuri, you were able to reassure the parents that while the timing of surgery is important, it's not the most important thing and it's not catastrophic to have some delays. And so that role of really serving as a reassurance, as giving parents some actual active information about what the impacts of a delay might be. And then at the appropriate time, obviously pushing to say, yes, now let's push and see what the Ministry of Health says. Is that right?
Yes, just that we have in this moment to change a little bit our message that people are believing that it's so crucial that the child is not operated and the speech will not develop. But all these things could be very relative. And if it's a real life-threatening situation, yes, we have been allowed it to work. But also important to reassure the parents and to say that we have to keep the contact. And this is also something that we had to do. And I think that I succeed to do it for several families.
Thank you, Yuri. Anyone else?
Marina has a very good point about the team approach and how CCC is important in order to have support but also build the confidence and not confuse the parents. So maybe Marina can explain a little bit more.
Hi, morning to everyone. Well, I think it's really important, and that's why I think it's so important that we have these meetings in a regular way, because we can support parents if we all speak, in our team at least, the same language. So if the surgeon says something about caring after surgery, we should all say the same thing to the parent, because if the surgeon says you have to clean, and then the other one says you don't have to touch anything because it's dangerous, and the other one says another thing. So the parents got confused and they are insecure about the treatment. So that's really so important that we really all speak in this sense, I say the same language, that we really can support and build the confidence of the parents about our team and about the treatment and about the well-being of the child.
Very insightful. Thank you, Marina. Thank you, Abdon. So part of that work then of reassuring parents really has to do with making sure that your team is connected and speaking from the same book or singing from the same book, for example. So that's a really helpful point, that connection among the team members, even with all the constraints, is so important. Thank you. Anyone else? What are the primary concerns that parents are facing in your context? For those of you on this call, what are they worried about? What are you hearing as it concerns the pandemic delays?
Well, probably one of the major concerns is about the delays of the surgery. In Fundación GANS, we are resuming all the surgeries for the last 2 months or 3. But I think that was one of the major concerns of the parents, that the delay of the optimal timing in the surgery. I think that was a concern, because you can't do it by telecommunication. You just need to do it in person now. You can have speech therapy. We can have some dental assessment at the distance. Of course, we can't treat the patients, but we at least can give them some support. But they know, because it's everywhere, when it's the best timing for the surgeries. And I think that's probably the most, that gives the parents more anxiety, I would say.
Thank you, Marina. A perspective from Chile. Another topic that came up along the chat was just the importance of both of these teams in Bulgaria and Costa Rica relying on a database, having really good access to patient information, especially when things are closed down, for example. So we heard from Costa Rica, some parents thinking, oh, well, this organization must have disappeared. I can't go to their office. And so really putting pressure on that idea of, the work that they had done on creating a database. And obviously that's something that in Bulgaria has been invested in very heavily, trying to figure out how to make parents active, keeping their information up to date, but also having some interaction online around that. So, that I think has come to the fore as a really critical practice. If you're able to put the time in to be able to keep up to date, then you have more opportunities to reach out to parents, even as they change cell phone numbers or move or whatever else. You have some opportunity at least to continue that connection point. Any other comments or questions about database and how that connects into working with parents? Carolina Caramaro in Argentina.
Hi.
Sí.
Hi, yes, in our team, the social worker has become a very important person, because, we didn't stop surgeries. We are doing less number than we used to, but especially because now we have to organize everything with more requirements. Like, we have to bring the child, and there is not public transportation now at the moment. I think they're coming back now, but what we did all this time is the social worker connected with the municipal is the local town, little towns that our people lives, and so she got the authorities there to bring the patient in a local ambulance or a local vehicle, and they had to be in the hospital 3 days before the surgery to do the test, the COVID-19 test, and stay in a hospital as isolated, the mother and the child. That part was very difficult for our patients, for our families to understand, because usually they come like in a tribe, mother, grandmother, aunts, fathers, everybody came for the surgery. And now was what it required a long conversation to them. Only the mother can come this time. No one else. They won't be able to get into the hospital to visit the child. And they say, oh, but we need to be together. We want to see the child. No, they will not be possible. So that was a big job for the social worker and the psychologist and the surgeons too, because it's like they want to speak to the surgeon to see if the surgeon will give permission to stay 3 or 4 people in the room.
Excellent. That's very helpful, yeah. Carolina. Thank you for that perspective from Argentina. And then really back to that point that Marina made about having everyone be on the same message. So everyone needs to understand, yeah. Because to reinforce, and I also really appreciate that emphasis on social work. You know, at this time where so much more stress is being experienced and new procedures, new ways of doing things, having someone on the team or many people on the team who can communicate effectively with parents being so important. We're running almost out of time, but 2 great comments we had from Erica in South Africa. Again, just that challenge around delays for surgery being #1 for parents in terms of stress and concern. And then Adiola in Nigeria. It's interesting to hear how connections are being made with parents on social media and all. Our team being challenged by the limited access to internet, we use to exchange phone numbers among parents. So both, you know, saying if they can't make it online, if they don't have access, they don't have devices, maybe they can still call one another to support, and then hear around, you know, tangible ways of explaining things like flyers about nutrition, etc. So thank you, Adiola. That's very helpful. Our time is almost done. Niti, I think we've got a couple quick, very important notice. Huge thank you to our presenters and also to those who have engaged in this discussion afterwards. I think we're all learning something as we go along. So all this will be posted. This video will be posted on Slack. If you have someone on your team, maybe a social worker or a speech therapist who might be interested in viewing this, this will be available shortly, both on YouTube and on Slack shortly. Niti, next slide. We do have, and Niti has created some curated playlists. So if you have a speech therapist on your team who's has some time right now and wants to do some learning, there is a way of watching specifically the speech therapy connected COCP webinars from the past. And so that's really exciting, as well as from our webinar conference that happened in September. And then finally, Niti, I'll invite you to do our final little plug here with the minute that we have left.
Yeah, so all of you as COCP members would have received an invite from us to fill in the CCC COVID survey. It's a very brief survey that will take you no more than 10 minutes to fill in. It's available in 6 different languages, and your responses will really help us as a global NGO community to more appropriately support local cleft teams during this phase of the pandemic. We've received more than 120 responses from several different countries. The deadline is really close, so if you haven't yet filled it in, I would request you to please do so as soon as you log out of this webinar.
Please, yes, don't do anything else. Jump on, complete the survey. It will be very helpful to us. We're delighted to see all the response so far. If you want to be up to date, and thank you, Sauda, for the shout out to your social team, your social work team, that they're going to watch this. We do have a YouTube channel where you can follow. And again, thank you to all our NGO sponsors. If you're thinking, there's something they haven't covered yet, we'd love to cover, send us an email, info@cleftcircle.org. We'd love to hear the webinar topic you'd like to hear, and we'll help to find a way of addressing it. We're always looking for new ideas, and we know that as we're growing, the expertise of this circle continues to expand as well. Thank you very much, everyone, for making time this morning, this afternoon, or this evening. We're delighted to have you, and a major thanks again to Jana, Lisseth, and Carolina for their work and preparation and giving us many things to think about today. See you next time, everyone.